how you doing? We're here for another quick case discussion today. The question we've taken from the WisePrep app today is a very important medical emergency. But I won't tell you any more about it, I'll let you come to your diagnosis. So here's your case. A patient presents to the casualty with history of road traffic accident. At presentation, the patient is gasping with a respiratory rate of 28 per minute. Pulse rate is 126 beats per minute. Blood pressure is 76 by 48 mm Hg. Not responding to commands, disoriented, making incomprehensible noise. His JVP is markedly raised. On inspection, you see nasal flaring, intercostal muscles are being used. On auscultation, there is absent air entry into the left chest. The hyperresonant sound on percussion is heard over the left hemithorax. Apparent laryngeal deviation to the right is present. What is the next line of management? We're going to take this step by step, so why don't you pause the video here for a minute and come to your diagnosis and we'll take it forward from there. Right, now that you've got your diagnosis, let's go through it together and see if we land on the same diagnosis as well. Your patient on inspection clearly shows respiratory distress as seen by his gasping, nasal flare, use of accessory muscles and high respiratory rate. On further examination, you also find absent air entry on the left side with a hyperresonant note on percussion, indicating excessive presence of gas in that hemithorax. Along with that, you have findings of mediastinal shift to the opposite side in the form of laryngeal deviation. Your patient also seems to be hemodynamically unstable as shown by his raised JVP, high pulse rate and low blood pressure, indicating low cardiac output. Now this paints a clear picture of a typical case of tension pneumothorax, which, as I pointed out before we started, is a medical emergency. But why is that? What is tension pneumothorax? Tension pneumothorax is the sudden accumulation of air into the pleural space caused by mechanical trauma as seen in a road traffic accident or during mechanical ventilation, etc. This creates a positive pressure in the affected hemithorax, leading to compromise in the ventilation, which can cause hypoxemia, and a decrease in the venous return to the heart, causing decreased cardiac output due to positive pressure in the mediastinum. Together, this creates a life-threatening situation which must be managed by relieving this pressure immediately. This is done by inserting a large bore needle into the pleural space through the anterior second intercostal space, leading to the escape of a large amount of gas. This needle must be kept in place till thoracostomy tube can be inserted. This brings us to the end of our discussion today. If you liked this discussion, please like and subscribe to our channel Med School Grammar and download the WisePrep app for more such questions and cases. See you in the next one.